Welcome, everyone, on behalf of the Division of Computing, Data Science, and Society. Creating informed responses to COVID-19, Berkeley's Computing and Data Science in Action. I'm Jennifer Chase. I serve as the Associate Provost of the Division of Computing, Data Science, and Society, and the Dean of the School of Information. On behalf of UC Berkeley, I am so pleased that you are joining us for today's conversation with our researchers. They will share their investigations and discoveries as they mobilize computing and data science to take on the COVID-19 challenge. Let me first introduce our roundtable of participants. All of them are faculty at UC Berkeley. First, we have Maya Peterson, Associate Professor of Epidemiology and Biostatistics at the School of Public Health. Next, we have Michael Eisen, Professor of Genetics, Genomics, and Development in the Department of Molecular and Cell Biology. We also have Sandrine Dudouin, Professor and Chair of the Department of Statistics and Professor in the Division of Biostatistics in the School of Public Health. We have Max Shen, Chair and Professor in the Department of Industrial Engineering and Operations Research and Professor in the Department of Civil and Environmental Engineering. We also have Emmanuel Saez, Director of the Center for Equitable Growth and Professor of Economics. After that, we have Henry Brady, Dean and Professor of the Goldman School of Public Policy. And finally, Kathy Yellick, Associate Dean for Research of the Division of Computing, Data Science, and Society, and a Senior Advisor on Computing for Lawrence Berkeley National Lab. All of these faculty will be addressing questions from our moderators and some from the audience during this roundtable discussion. Finally, let me introduce our two moderators. They are the leaders of the two organizations which are co-hosting this event. First, Saul Perlmutter, who is director of the Berkeley Institute for Data Science. He is Professor of Physics and Nobel Laureate. And next, Michael Liu, Dean and Professor of the School of Public Health. Thank you so much for joining us for this roundtable discussion.
Thank you, Jennifer, and good morning. Before we start, let me just invite our streaming audience to continue to add questions to the event website. They're very helpful for us, not only for today, but also so they can be addressed in the upcoming series of webinars, which we're hoping to go into a little more depth after today's broad overview. Let's start with you, Maya. You and your group have been working with a number of local government health departments. What is challenging them now, and how can computing and data science help meet these immediate needs?
You know, there's been a lot of variability in how the epidemic has progressed across the United States over the past weeks. So things have been changing fast, and they've not only been changing fast, they've been changing differently in different places. And in the face of this variability, local governments, local health departments, and hospitals have really had an urgent need to better understand the status of their local epidemics. Where are they and where are they heading in order to help them make real-time decisions? They need to know how many people in their local community are likely to be infected now. And over coming weeks, how many hospitalizations with COVID-19 should they expect and plan for? How many people will need ICU beds? How many will need ventilators? So these are real-time decision needs, but the data that's been available to guide these decisions are really imperfect. There's lots of uncertainty, and the decisions still have to be made, right? So this is kind of the challenge that has been facing a lot of these local health departments. Early on, there were also decisions about whether interventions should be enacted or not. How fast should communities move to shelter in place, or are there social distancing? As well, should they open surge capacity for their hospitals? So all of these are real decisions, and we've been trying to work with them to help use the data they have to make informed decisions in the face of this uncertainty. So to do this role, you really, it's an unusual role in the sense you really have to work with the data you have and not the data you want. Um, we don't have perfect data. So far, testing has really been limited, and the way in which it's been rolled out really differently in different places, changing over time, has made it hard to use testing data to guide this kind of response. And so what our group and others have been doing is we've been working with data that are more widely available, such as the number of patients who are in the hospital each day with COVID-19. And then trying to take those data and make sort of carefully reasoned inferences about where a given local epidemic is likely to be, where it's likely to be going in the short term, and also how uncertain are we about those projections, because you can't provide meaningful decision support unless you can accurately quantify your uncertainty as well. And so that's the role that my group and other groups as well have been taking and trying and working with local health departments. In this space, I also wanted to just note there's been amazing work being done with Joe Lunard's group, also in the School of Public Health. So he's been leading a group that's working with the Kaiser Permanente group across California and Washington as well. And I was speaking with him last night, and it's exciting to hear that the governments of both Finland and Canada have also now adapted some of his modeling tools. So as you can see, I think there's really a tremendous need for this sort of decision support. And that need really does span the range from the very local to the national level. But in all cases really requires us to bring to bear these combined tools of core epidemiology principles, understanding of public health, solid understanding of data science and statistical principles, and computing, and really combine them, which I think it's been just an exciting time to partner between data science and the School of Public Health, because I think we're really seeing the potential for our combined efforts to make an impact at both the local and the national levels.
And once we're beyond these current challenges, what are the next steps that we need, I guess, to take toward recovery and preparation for future pandemics?
Yeah, absolutely. So, as I said early on, I think there was this question of, do we act? How fast do we act? How stringently do we act? And I will say that question hasn't gone away, particularly in some parts of the United States. So I think that's still there. But I think now moving forward, what's going to be key is extending these sorts of decision support tools to guide in a careful way how we can safely how and when we can safely reduce the intensity of our interventions like shelter in place while still maintaining control of the epidemic, let our communities get back online, but do it in a way that is safe from a public health perspective. I think in order to do that, it's a hard problem, right? I mean, it's a hard problem because there is a lot of local variability in terms of what interventions have been enacted where. And not only that, there's no reason to think that there's going to be kind of a one size fits all effect. So, what shelter in place means and how it impacts transmission may well be very different in different parts of the United States. It has to do with how well communities are able to sort of adhere to these recommendations. Vulnerable populations may be very differently impacted by guidance like shelter in place. So, public health intervention that says stay in your home means something very different if you don't have a home. And it means something very different for you and your health. And it also means something different for your broader community. And so I think moving forward, there's a real need to expand our focus when we think about designing effective public health interventions and safe ways of backing off those interventions to really take into account both the variability in how an intervention is working in different places, as well as variability in terms of how it's impacting different segments of the population. I think a real urgent need moving forward will be focusing again on these vulnerable populations, understanding the impacts of some of these responses and understanding how to support vulnerable populations as well as our communities as a whole to get back online. I think another key piece of this as well is the data are going to keep evolving, right? So early on, you go to war with the data you have, not the data you want. But we're increasingly going to be moving into a place where we are more data rich, and there's ability to bring these diverse data types to bear on these very urgent questions. And so I think that's another very exciting frontier. I think it'll again be this interface of diverse data types and state-of-the-art analytics, but also kind of shoe leather public health and epidemiology. And so, for example, my group is partnering with Diane Havler's group at UCSF to roll out two sort of population-wide, community-wide testing efforts in the communities of the Mission and Bolinas to help us start getting a handle on some of these basic questions and guide the health response. So I think it's going to continue to be all hands on deck across the disciplines, but that also makes it a very exciting time. And kind of just to speak to your last point, how will this help us prepare for future pandemics? I think it opens the door to, or gives us an opportunity to develop these systems and these partnerships and these collaborations so that we really have the tools in place the next time this happens to act in the most informed way, in the way that's best for our communities, and smoothly with sort of integrated systems in place. So I'm very, it's a challenging time for everyone, but I have to say it's been a very inspiring time to see the wide range of expertise that's being brought to bear on these problems, how well we can work together and how much of a difference it can make. And I think that will carry into the future as well.
Well, thank you, Maya. I have a question for you, Mike. In addition to responding to public health needs, the pandemic is quickly presenting biomedical questions. So how's the field of biomedicine approaching the issues that COVID-19 presents?
So biomedical scientists across the world have pretty much dropped everything they're doing and begun to work on COVID and COVID-related problems and solutions. I think you can see, just at Berkeley, the Innovative Genomics Institute, which is Jennifer Doudna's CRISPR Institute, has been nucleating our efforts here. But you're seeing similar things at institutions across the whole world, and you can break these down into three categories, right? There's this immediate rapid response. And I think the first thing people asked is, we've got all these skills, we've got all this equipment, we're biologists working on a biological threat. What can we do right now to help out the effort? And the biology community very quickly, I think along with everybody, recognized that our biggest immediate problem was a lack of adequate testing for the infections with the virus. So you see at Berkeley, you saw over across the Bay at UCSF and the BioHub, very, very quick mobilization of scientists who have skills in doing PCR and the other kind of assays that are used to look for the virus, within the matter of a couple of weeks, transforming research labs from their standard purpose into high throughput COVID testing facilities, to the point where right now in the Bay Area, we seem to actually have an excess of capacity for testing people for COVID. So I think it's been really impressive to see this immediate response, which is just using our skills and equipment in the best possible way to try to help out with the pandemic response. And then the second thing you're seeing is a real refocusing of a lot of the basic biology research that people do onto this virus. I mean, there were people working on coronaviruses already because of SARS and MERS and the other viruses that came about. But now you're seeing tons of people, even without access to their labs, because most of us aren't allowed into our research labs for social distancing reasons, refocusing the research efforts around trying to understand this virus. And a lot of that involves looking at DNA sequence data and trying to think about how to apply kind of basic research in immunology and virology in pulmonology and all the other areas that are related to these infectious diseases. So there's already been a tremendous amount of just basic research and thinking into understanding this particular virus that is having an effect on the way that people are thinking about it, how we're going to deal with it in the future. And I think, as Maya pointed out, this is likely to not be the last big coronavirus pandemic we face in the coming years. So this research is not important just for now, but for the future. And I think that the other thing that you're seeing a lot of is the community. I should say that there's also the kind of classical things we do when any kind of new disease comes about. People are trying to figure out how to screen libraries for drugs that work against coronaviruses, and all the basic infrastructure we have for dealing with disease in general is now being refocused on the virus. So the other thing that's, I think, really exciting is people are asking themselves questions like, all these new technologies we've developed for research purposes to detect RNA in solution, to use CRISPR to knock down the expression of genes in cell lines for research purposes, that people have been thinking about clinical applications for some time, but really haven't gotten there. They are being mobilized at an immense speed to try to develop new rapid diagnostics. So we might be able to meet the dream of testing everybody who gets onto a BART train for whether they're infected with coronavirus, to come up with completely different ways of suppressing the infection that we can deploy more quickly than classical vaccines and can respond more quickly to epidemics like this. So, basically everything that you could imagine biomedical scientists doing is being done and has gone from zero to infinite speed in the matter of a month.
And Mike, can you talk about what roles do computing and data play in finding and sustaining the kind of biomedical solutions that you're envisioning?
Right. I mean, it's just been a massive transformation in biology in the last several decades, from a field where people studied one gene or one molecule at a time to, basically all molecular biology now is a data field. We generate data in massive scale, and at this IGI, the Innovative Genomics Institute, one of the first challenges that was identified by the biomedical researchers in basically every field where people are doing experiments was they need help in thinking about and understanding the data. And so a huge group of data scientists from Berkeley are already working with the biomedical researchers to solve problems from the mundane, like how do we track clinical samples as they come into the testing facility and make sure that this is being done in the way that's compliant with federal regulations, to kind of advance research and thinking about the evolution of the coronavirus and how to manage all the massive streams of genomic data are going in. So there's not an ongoing process in the biomedical community that isn't being supported by, and in some cases driven by data science.
Thank you, Mike. Well, I guess it's clear that that both public health and biomedicine are drawing from statistical methods and tools in all this understanding of COVID-19. So this naturally brings us to Sandrine. Sandrine, can you give an overview of the approaches that you and your colleagues in statistics are taking to bring robust statistical analysis to bear?
Yes, of course. Good morning, Saul, and good morning, everyone. So the contributions of statistics to COVID-19 research, as for any other type of investigation, broadly includes framing questions. In other words, translating a possibly vague domain question into a precise data-informed question, and involves identifying the relevant data and procedures for collecting these data. There's exploratory data analysis and visualization for the purposes of quality control, as well as for finding the main features of the data, whether these features are good or bad. There's, of course, the development and application of inference methods to answer the question of interest as accurately and reliably as possible. And finally, there's the translation of the results back to the domain. And of course, access to reliable software is needed every step of the way. When lives are at stake, as is the case now, data quality is more crucial than ever to avoid garbage in, garbage out, or GIGO. Likewise, for the soundness of the methods that we use, we want to make sure that the results are driven by the data, by good data, and not by dubious modeling assumptions.
And maybe you could tell us something more about the specific projects that you're all working on right now.
Yes, actually, the projects that I'll summarize below connect very well with the efforts that have already been mentioned by Mike and Maya. It's really been particularly inspiring to witness the dedication and the energy of colleagues across campus and the breadth and depth of these research efforts. So for instance, in statistics, my colleague Ben Brown is collaborating at the Lawrence Berkeley National Lab on the discovery of antiviral compounds against SARS-CoV-2 and on the benchmarking of testing platforms. The importance of testing is already mentioned by Mike and Maya, so we really want to make sure that we get accurate tests for the disease. With our neurobiology collaborator, John Nye, Elizabeth Purnham and myself are involved in a study of the molecular basis of CoV-2 infection using high throughput transcriptome sequencing. Nick Jewell, also in biostatistics, is a renowned expert in the statistics of infectious diseases, and he's involved in epidemiological studies. He's consulting with Kaiser and has written for the New York Times about the pandemic. Jacob Steinhardt is very actively engaged with researchers across the globe on data gathering efforts and in epidemiological modeling. Jazz Seacon is informally advising the US federal government on epidemiological models of COVID-19 growth and on their implications for policy. Binyu and her group are working with the nonprofit organization Response for Life, also with Max Shen, on supply chain management for connecting suppliers and hospitals that are in need for equipment like masks and ventilators. Lisa Goldberg and Philip Stark are leading a weekly reading group to review and vet the literature on COVID-19. There's really so much out there that it's crucial to separate wheat from chaff, particularly given the life and death implications that we have here. Fernando Perez and his group have set up an open source help desk. You can think of this as a fast track Stack Overflow. And the purpose of this effort is to connect researchers working on COVID-19 to the people that actually wrote the software or experts in its use.
Great, thank you, Sandrine. Now we'd like to take about 15 minutes or so to address some of the questions submitted in advance of the webinar today. The first question goes to Mike. What role is data science playing in identifying promising candidates for a cure or vaccine?
So there's been obviously a lot of interest in developing vaccines for COVID, and one of the first questions that people ask obviously is what should the targets be? Now, for vaccines, there's not a lot of candidates. The surface of the virus has one main spike protein, sitting out on the top. But one of the big important insights that data science has brought to this question has been looking at the genome sequences of viruses as they've come forward. There's a fantastic website run by a researcher named Trevor Bedford up at the Fred Hutchinson Cancer Institute called NextStrain that has been collecting genomes of the virus as they've come in initially from China and now from across the world. And they've shown something incredibly important, which is that the virus is evolving relatively slowly compared to, say, influenza or other viruses that we tend to worry about like this, which means that the people who are working on vaccines that are targeting the spike protein of coronavirus can do so with some comfort that the vaccines that they develop now will work against the virus a year or so down the road when the vaccines actually come into deployment. So that is is probably the perfect example of a data scientist. Trevor Bedford's a data scientist who gathers genome data from across the world, is having an impact on how people are thinking about combating the virus. There's also been a huge host of genomic studies using the latest things like single cell sequencing and the analysis of people infected with, or model systems where they're looking at infections with this coronavirus to try to identify targets. So there was a great study from across the bay at UCSF where they identified proteins that are interacting with proteins from the coronavirus, and these are they're experimental problems, but they're also massive data problems where they're parsing through huge amounts of sequence data and genomic data and proteomic data to try to find potential promising targets. And if you look at the papers that are coming out of these things, they're one part experiment and two parts data analysis and data science. So I think basically everywhere you look in the fields of either disease prevention or disease treatment, you'll see a fingerprint of data scientists and advanced data scientists guiding the work.
Thanks, Mike. The next question is for Maya. Maya, how do we push back on the urge of to build meaningless models on unreliable data and instead use common sense and goal epidemiological?
So this is a great question. I love it. So first, just to say, I'm very in favor of common sense and good epidemiological principles. And I think that we can use them together with models and with data that we have to make good inferences, but it's a hard thing to do. I think, again, to get back to kind of basic principles, which Sandrine did a great job outlining, I think you have to start with, what is your question? And what data do you bring to bear that you can use to try to answer that question? And here we're really in the situation where there's not a one-size-fits-all answer to that. So the types of questions we have range from truly the national or the global level of, what should a national policy be? How can we mitigate economic impact, for example, in some of the work that Jazz is doing that Sandrine referred to, down to the very local level, which is, what are the appropriate immediate local public health interventions to take, and how can we use data available at a local level to guide those appropriately? And so I think the short answer to that question is, because the questions are going to be different and because the data available to guide those questions are going to be different, what a good model is, or what a good analytic approach is, will also be different depending on the question. And so there's really a role for, I think, a whole spectrum of complexity in terms of the modeling tools we bring to bear. And I think, again, I think there's a role for a spectrum of data. So in a perfect world, we have great data. Sometimes we have to make decisions with less great data. The key to doing that well is not ignoring the fact that the data have challenges, but it's also not throwing up our hands and saying we can't say anything because the data are unreliable. It's really trying to navigate that tension in a responsible way and make sure that when we're giving answers to help make decisions, that they really reflect all the uncertainty that's going into making those recommendations, including uncertainty in the data, including uncertainty in the model assumptions. And so I think this is it's a very important space, but it is a walkable line. It is possible to do that, but the right way to do it will differ depending on the type of question and the type of data available and exactly how the results of that model are going to be used. So I think there is absolutely a role for common sense in guiding that, for good epidemiologic principles in guiding that, and also really for the state of the art in both public health and data science and statistics for helping us know how to do that well.
The next question is actually for Sandrine. What role can natural language processing play in extracting information for the response to the pandemic?
All right, well, what types of questions then does NLP answer? If these questions are relevant for the response to the pandemic, then yes, I think it makes perfect sense to use NLP. So NLP is typically used to process and analyze vast bodies of text data, either in some exploratory manner or with a particular goal in mind. So in the context of COVID-19, we might want to use NLP to help assess the quality and reliability of the abundant literature on the topic. We could also think of analyzing this literature body to help identify which antiviral compounds to focus on by searching, for example, are certain keywords or associations between keywords. There are a number of efforts at BIDS in this area, for example, TextXD or Text Across Domain with Heather Havman, Marianne Barrett, and Sierra Martinez. So this is definitely, there's a lot of questions that you could address with NLP, but you have to make sure, again, that you start from the question and then see what method answers that question.
And then there was another follow-up question from the audience, which was, what kind of machine learning models matter most during the ongoing fight with COVID?
So I know it's very tempting to use the latest deep learning technique or neural net with all the bells and whistles. But before jumping to that, I think it's really essential to make sure that you're asking the right question and that the method you're using actually answers that question. And Maya already said that very eloquently just before me. So I would first start with the question, then frame it and then identify an appropriate method for the question. Otherwise, you just have a hammer looking for a nail, right? And I really like this John Tukey quote, which I keep using over and over again. And here goes. It's far better an approximate answer to the right question, which is often vague, than the exact answer to the wrong question, which can always be made precise. So sometimes actually all that matters is looking, well, first of all, at the right data. You have to make sure you're looking at the right data. And a simple visualization can give you a lot of information. Sometimes also calculating just the right proportions. In other words, having the right numerator and denominator makes a big difference. Then depending on the question that you're trying to address, if it's about prediction, for example, you could use a simple linear regression model or a generalized linear model or ensemble methods. But you always have to be very mindful about the modeling assumptions. And in many cases, a very simple method can take you a very long way.
So we have another last question, actually, that's for both Maya and Mike. So maybe Maya first. So absent a cure or a vaccine in the near horizon, how will the models inform our response?
So I think, again, we're going to need to be thinking about how we can responsibly back off the most intensive public health interventions. So right now, many places, and including locally, we're in shelter in place. So I think we need to understand, is it working? How well is it working? How well is it working to reduce transmission of the virus? What can we say from the data that we can get? And again, I think the types and quality of those data are expanding rapidly, so that will help a lot about where we are right now in terms of how many people have been infected, how many are currently infected, what does transmission look like? I think with better information in those areas, I think models used cautiously and judiciously will be one part of the answer in terms of guiding us when we can move towards alternatives like testing, tracing, quarantine, and face masks to help get parts of our economy and parts of our communities, back online. And we've seen efforts like this being put into play across the world. And so I think we can learn from global efforts. But I think also there's a really opportunity to learn from our own local efforts as we begin to collect data locally. And in addition, I think there's an opportunity here for some parts of the country that enacted interventions relatively earlier in the epidemic to perhaps provide lessons learned for other parts of the country as well. So that's where I'm hoping to see this go over the coming weeks to months. Is while we don't have a vaccine, can we start to get a handle on what sorts of interventions work and how we can deploy them best? And I think that part of that is modeling, but there's going to be other parts of it as well. And certainly, classical epidemiology and statistics, and absolutely back to the first question, good common sense, which should never, ever be discounted. Yeah.
So can I also just weigh in, Saul, that that in the biomedical community, one of the things we recognize is that the epidemiologists need good data. And one of the things that probably greatly affects what types of strategies we can implement is how well we can roll out rapid, quick, cheap, wide-scale testing. So if the best we can do is surveillance of a small fraction of the population, that affects the kind of strategies that you can implement. So we're definitely trying to use this time that we have in shelter in place to figure out how we can do something much more dramatic. How can we identify everybody who's had the virus, the infection, and how can we very quickly and easily, without shoving an invasive swab up someone's nose every time they get on a train, figure out how is the epidemic going? How can we identify people who are infected? Because that's what we really want, is maximal information, and we're so far away from that right now that the models can't work at full effectiveness. And I think the biomedical scientists know that that's our greatest opportunity to contribute right now.
strongly second that. Just strongly second that. Not just to inform the models, but actually as part of the public health intervention, as you're saying.
Absolutely.
Like,
Yeah,
that's exactly right. I mean, that will be the key linchpin of the intervention itself, not just understanding and modeling it. Absolutely.
Oh, thank you, guys. All right, well, let's come back now to our roundtable, and let's move towards some of the other disciplines and research areas and market sectors that are responding to the pandemic. So the impacts of COVID-19 led to really significant supply chain problems, obviously. And so, Max, what are some of the most pressing supply challenges that hospitals and citizens are facing?
Oh, hi. Thanks for the question. So we have seen so many important, great challenges facing us. And one of the most pressing supply chain challenges is the imbalance of supply and demand. And we have seen so many different supply chains that are experiencing such imbalance. So I can give you two examples. One is PPE, the other is toilet paper. So we all know now we are facing great shortage in PPE, and this was caused by supply disruption, especially the production of N95 masks, which require special fabric that is in very short supply. Toilet paper shortage, on the other hand, has been caused by an irrational demand surge. This is not uncommon. When Hurricane Katrina hit the US in 2005, the crude oil drilling and refining industry along the Gulf Coast was severely impacted. So people watched the TV and news and then figured that maybe the gasoline supply would like to be in shortage. They line up at gas stations, try to get as much gasoline as they can. As a result, we actually encountered gasoline shortage, and the price of gasoline doubled, even tripled in some areas of the country. However, the fact is that the oil drilling and refining capacity in the Gulf Coast represents only about 7% of the oil consumed in the US. So the overall supply of gasoline should not have been affected substantially. The shortage was caused actually by the consumer panicking purchasing behavior. So similarly, the shortage of toilet paper is a result of people seeing the empty shelves on their TVs. So the other challenge I would mention is really the reduced capacity of the supply chain due to this social distancing related restrictions and the lack of workforce and raw materials. Reduction in supply chain in the capacity happens almost every stage of the supply chain, from manufacturing to warehousing to transporting the products. I'll give you a few examples. Due to social distancing, now in the warehouse, if there's a heavy box to be lifted, used to be that you require 2 or 3 workers to do it together, but now due to social distancing, only one worker can be there to lift the box, maybe use some help of the equipment. Also for long haul trucking, typically you would need 2 drivers to drive the truck for long distance because they can take turns and one of them can rest for some time. I think by law, the driver need to rest for 12 hours a day. But now, due to social distancing, two of the drivers cannot sit in the same cab. Similarly, in the warehouse, because of the social distancing, they cannot have so many people working in the warehouse. So the reduced capacity caused much more problems to the supply chain. I can go on and on. There are so many different challenges, but due to time limit, maybe we can discuss some of them in the following webinars.
So how are actually you and your colleagues bringing operations research to address these challenges?
Good. Thank you for the question. Some of the challenges we are facing right now can actually be addressed by designing and optimizing a resilient and fast response supply chain. So the supply chains will be less vulnerable to disruptions and demand surge. So one aspect that operation research can help is to determine the amount of strategic stockpile we should keep to deal with future events. For instance, we do keep a large amount of crude oil for strategic purposes. So maybe we can do something similar for a ventilator or some important equipment. But doing so can be really expensive, and we don't really have good data on the future demand. So it may not be suitable for every possible material or equipment that we may need. Another approach operation research can help is to design a flexible production and sourcing plan. So the government can negotiate a contract with some big firms ahead of time. So when emergency like this happens, the firms can quickly start their production to make the necessary equipment. We are doing right now is to negotiate firms after these events happen. Will take a long time to identify the suitable firms, and then also will be another lengthy process to negotiate with the firms. So we will waste our time there. If we can help design a flexible and a quick solution, it will be really helpful.
And these are projects that are ongoing in the.
Yes. So we have many people working on supply chain issues. For example, Rob Lichman, Phil Kaminsky, Ken Colbert, and me are all working on supply chain related topics. So and we are working closely with industry.
And then finally, what are you and your colleagues looking for from the data sciences to help with all these the solutions here?
Yeah, that's a great question. Well, first we need help to get data. We don't have data at all in many of the scenarios we are working on. With BV, I think Sanjay mentioned that BV and I are working on basically match supply and demand for some of the medical equipment. It's been really a struggle to get all the data we need. For example, we don't have easy access to many things. How many PPEs we have right now, how many ventilators we have right now in the country. Maybe different states have different number, and how many of them are being transported to us from other countries. How many of them are we making right now or in the near future? What is the actual demand for these essential goods? So if we have all this data, then the problem of matching supply and demand would be a little bit easier to solve. So first of all, we need help to get data. Secondly, some of the former panelists mentioned the models and tools. Yes, I think we need to work together to develop new data-driven decision-making tools. So these tools will be really different from the traditional operations research or statistical tools. Which we have to make many assumptions because we don't have data. But with the inflowing of good quality data, I understand that there will be a big need for data-driven tools in solving these real supply chain problems nowadays.
So let's turn to the financial impact of COVID-19. So Emmanuel, citizens around the world are wondering how they'll be able to weather it financially. How can we get through this in the near term?
Yes, so this is a great question. Yes, so on the economic front, it's obvious now to everybody that fighting COVID-19 and the social distancing it requires is creating enormous economic disruptions. So it's really changing the way the economy operates. So economists have turned towards, urgently towards this problem. So the first issue is trying to measure how much of the economy is being shut down due to the lockdown. So various government institutions and academics like ourselves are working on that issue, and we can say that about 1/3 actually of the economy is shut down during severe lockdowns like the one we have here in California. So that means that about 1/3 of workers keep working in essential work. 1/3 of workers are able to work from home online, on the computer like we are doing today. And 1/3 of workers have lost their jobs. Okay, so it's obvious that this economic disruption is going to create enormous hardships. People are losing their livelihoods, workers are no longer able to work, and businesses have to stop their operation, and therefore they are at great risk of being destroyed and going bankrupt if this stays on for a little while. And so it's a real hardship for a lot of people, because people who lose their job are disproportionately from the bottom end of the income distribution, where savings and wealth is really low. So people don't have a cushion to absorb that shock. So that's why intervention through the government is absolutely essential to alleviate this economic hardship.
And then what is the potential role of social insurance and state intervention of that kind?
Yes, so that's the other aspect on which economists are working. That is, how can we mobilize the government? How can we design public policy in urgency to help alleviate hardship? And so the idea here is that in the short run, while the lockdown happens, there's nothing you can do to bring back output, because restaurants, meals are not happening, plane travel is not happening. But what you can do as a society through the government is to alleviate hardship, that is, make sure people who've lost their jobs still receive income to get by, and make sure small businesses or businesses that have stopped operation can somehow survive the lockdown, so that by the time the lockdown is over and the economy can slowly resume, they can spring back to life, so that the recovery is fast. So what we see around the world is various approaches, but on one hand, I would put, the European countries that have decided, to essentially hibernate their lockdown economy. And in that case, essentially, the government pays for the wages of the idled workers, but the workers stay attached to their firms. It's just that instead of having the business pay them, the government pays them, and the government also pays for the maintenance cost of the businesses. And the idea there is really freeze the economy. Let's not have businesses get destroyed and people becoming unemployed, so that hopefully if the shutdown is not too long, then things can resume as normal very quickly. In contrast, in the US, we've seen already, dramatically mass layoffs. 10 million people have lost their jobs. And the US has taken an approach where, look, mass layoffs are going to happen, and we are going to try to alleviate hardship by providing more generous unemployment insurance for those who lose their job, some loans to support businesses, and also direct payments to individuals. So this approach, in my view, is not as good as Europe if the shock is of short duration, because still a lot of businesses are going to be destroyed. People are going to be separated from their jobs. So it might take a while to recover from that. But in talking, to policymakers around the world, what we noticed is that to be able to create those programs on the fly, it is absolutely crucial to have a good data infrastructure. And some countries, like in Europe, had that pre-existing data infrastructure because they had work sharing programs to make sure people stay on the job with reduced hours subsidized by the government. Germany is a famous example. Absent this, it's very hard to keep businesses alive, and that's why the US had to rely on that perhaps not ideal solution of letting layoffs happen and then subsidize workers. So certainly, the lesson of this crisis is that data infrastructure is absolutely central, so that you know what's happening to your economy, who is getting hurt by the crisis, and where you want to direct the money as a government to alleviate hardship.
That's good. That's interesting. So let's turn to Henry then, because on another important front, can you describe how we're going to hold the primaries and the general elections online or by mail and maintain social distancing?
Well, today we have an extraordinary situation where we have people actually standing in lines at polling places in Wisconsin and voting. And you have to believe that this is going to lead to the spread of the COVID virus. And so it's all because a Republican legislature and a Democratic governor couldn't agree to postpone the election, the primary election, but it also actually turns out to be a state and local election with offices being determined at this time. So the way to solve that problem is to have more vote by mail. And indeed, we can do that. We have 5 states right now, mostly Western states like Utah and Colorado, Washington and Oregon and Hawaii, which already vote by mail. So we can do that. Of course, given the American system where most states require registration, we also have to deal with the question of how do we get people registered online. Typically, that often requires a trip to an office where you present an identification card and so forth. Some of that can be done because more and more states now are in fact allowing registration online, but they often require a driver's license. So here we get into the problem that folks who really are citizens and certainly eligible to vote may not have a driver's license. And we have to figure out ways to make it possible for them to register online by presenting evidence of other documents and so forth. So yes, we can solve the problem by voting by mail. We just have to get the will to do it. And we also have to get beyond some political issues. Donald Trump the other day complained about the fact that the big stimulus bill, which I would actually call more like a protection bill, that was trying to protect people who were out of work, that bill initially had $2 billion to try to improve voting systems. In the end, it only has $400 million because, as Donald Trump said, if you enacted all the things that are in that bill, a Republican would never get elected again in this country. So there's real differences between Democrats and Republicans about whether or not we should enlarge the franchise. And that's part of the problem we face. And it may be the problem we face as we try to get states to go to vote by mail.
And then how do you see data science helping to ensure that this voting is secure?
Well, data science could be crucial here. And it's sort of like a supply chain problem and problems where you're just trying to keep track of documents and things. We could certainly deal with online registration and have all the states go to that. We could also have online registration systems that were linked with administrative records so they could quickly identify people and figure out whether or not they're eligible to vote from information on those systems. We could also deal with signatures online and with documents that people might have that prove they're citizens so that we could allow for registration online. And those are all problems that we know how to solve by and large, although better solutions may be developed. And so those are things we can do. In terms of voting online, we could also do that with people modeling an approach that's been used in Estonia, for example, which has complete online voting. The problem with that right now is many people are worried that it's not going to be safe. And so what we need is better cryptographic solutions that allow people to actually vote online without fear that somehow their vote's going to be hijacked. But at the very least, what we can certainly do again is vote by mail, and we can send out ballots to people. But if we're going to do that, we also have to figure out ways how to process all of those ballots. And that's going to lead to, in many states where a signature is required and other information, a massive effort to try to process all of those absentee votes. And so that requires better ways of using computers, perhaps artificial intelligence to compare signatures and things like that. So that there's tons of opportunities to improve the chain, the sort of supply chain of votes as we move from registration through the votes actually being sent to the Secretary of State and to the Secretary of State actually processing those votes.
So it's a big problem. So we want to turn now to Kathy as our final roundtable participant, and I wonder if you could round out the conversation for us from your vantage point, where you're both working at UC Berkeley and Lawrence Berkeley National Laboratory in the computing. What are the ultimate roles of computing and data science in blunting the pandemic and supporting a robust recovery?
Thanks very much, Saul. I want to, of course, start by acknowledging the heroic efforts of the medical professionals who are on the front lines of this, and all of the researchers across the different disciplines. But I think that right now at a global level, we're really in a data problem, right? And you've heard this from Maya, you've heard this from Max. We're in a situation where we're trying to understand the data that we have and interpret it, and then make predictions about the future, which involves computation, both for the analysis of the data and for inference and making predictions and using things like simulations. So, you know, I think the first thing that we've heard a little bit about, but I think is one of the first data problems, is about the non-medical interventions that we're working on. And that's the most immediate thing, which is what we have done. For example, in California, gone to shelter in place. And that's based on the data that we have seen, and also the predictions of where we're going to go with and without that, that kind of an intervention. So, you know, these different interventions come in different types. There's things, you know, very easy ones like washing your hands and staying home when you're sick, maybe limiting non-essential travel. And then there's the very hard ones that we're seeing, closing schools and businesses and having people shelter in place. We've all seen the graphs, the sort of cartoons of flattening the curve. And that's, of course, what we're trying to do with these various interventions. But what does that curve actually look like for the Bay Area, or for California, or for the US, or for any other country in the world? And so that depends a lot on the demographics of the people. It depends on exactly how they work, who they're connected with, the age and health and other factors that make up the population. And so, and of course that data, the flattening the curve image itself, has been so influential, I think, in affecting public opinion. People like Aditya Parameswaran and Hani Farid are looking at some of these issues of data visualization on the one hand, and misinformation or misuse of data on the other hand. And that's very important. But those curves, to get back to those, you know, they rely on having good data, so we know where we're at on the curve, and then trying to predict the future. The data is, and we've heard this from Sandrine and also from Maya, the data is very sparse. We have a limited number of data points. I know, Saul, you're very familiar with this in your work on understanding the expansion of the universe, which is you only get to look at a certain number of stars. But in this case, we're only looking at a certain number of individual cases where we have test results. The data is biased because I was talking to a nurse practitioner. They're only running tests on people who have very significant symptoms. And that means that not only do we have a small set of data, we have data that is really skewed towards one end of the distribution. And the data, it can be very noisy. There's lots of delays in when things are reported. Even something as fundamental as the number of deaths related to COVID-19 is not necessarily reliable data because, excuse me, we don't know exactly what the cause of death is in many cases. How do we predict the future? We do this by running simulations. Some of those are very detailed, and they take into account the number of people and how and the ages and what they're likely to be doing during the day and during the evening. And then we try to run those simulations with and without those interventions. And that requires a significant amount of computation.
And then, can you give us a sort of bigger picture of how the various federal agencies and national labs then are working together along with UC Berkeley?
Right. So let me say a little bit about my additional role that I took on about a week and a half ago, which was for the Department of Energy to serve as a co-lead of what they're calling the Computing and Data Tiger Team for all 17 of the national labs. So I think what we've seen at headquarters and under FEMA is this is an all hands on deck. All agencies are involved who have something to contribute. You might wonder what the Department of Energy has to do with a global pandemic. The Department of Energy has amazing national resources in terms of user facilities, so supercomputing facilities, advanced light sources of various kinds that can be used to look at the virus or at drug design, used in drug design and things like that. They have genomic facilities, synthetic biology facilities, and things like that. So in my role, I'm actually co-leading this with Fred Streitz, who's from Lawrence Livermore National Lab, but has been on assignment at headquarters, at DOE headquarters for the last year. He's actually stationed at FEMA, so I talk to him almost every day at FEMA headquarters, where he's trying to work with all of the other task force under FEMA and all the other people from different agencies trying to solve specific problems, but understanding how to bring the data and computing resources of the DOE to help them. And so I do see these, all of these groups and agencies working together on these problems.
Well, thank you, Kathy. So we ended up losing Michael Liu on the internet connection. His internet went down, but we have him still on the phone. So now, as we're going back to another more of the questions that were submitted in advance of the webinar by the audience, why don't Michael? Why don't you lead some of the questions?
So can you hear me? Okay.
Sounds good.
All right. Well, sorry, everyone. I lost my internet, but let me pose this question to Max. What modeling has been or could be done to understand how COVID-19 will quantitatively impact supply chains for needed household goods and pharmaceuticals?
Thank you, Michael. This is a great question, but it's also a really, really challenging problem to solve. So to really fully the impact, first of all, we need to build a really good forecasting model for all the demand, basically how COVID-19 will impact the demand for household goods and pharmaceuticals. So back to the PPE and toilet paper examples, if we could have better prediction, then the supply chain would have been less stressful to deal. So after we have the reliable demand forecasting, then we can use optimization models to help plan for the inventory, for the shipment. But it needs to be recognized that building such models is an extremely difficult task because it requires knowledge from many disciplines. Everybody in this webinar probably should be working together on the disease propagation and then how many people will have the virus and then how this impact the activities. So the forecasting model is really, really hard to build. Furthermore, real-time actions from different stakeholders in different countries may sometimes be unpredictable, but they have a big impact on the accuracy of the models. Just as one example, one of the biggest issues for healthcare supply chains currently has been the spread of medical protectionism. So this is really hard to predict and hard to manage. My courses and I have done some modeling of the impact of irrational purchasing behavior on the supply chains. So we coined the phrase reverse Hoover effect to describe the phenomena where the demand volatility increases as we move downstream in the supply chain from the manufacturers to the consumers. So this partially, characterize the kind of the supply chain situation we are in right now. We believe much more intensive research is needed to really fully understand the impact of COVID on our daily supply chains. Besides the OR model, OR means Operation Research Models, I also want to mention some other research activities going on in College of Engineering. I already mentioned Bing Yu and Ken Goldberg. Actually, Ken is working on robotics and automation of the picking activity in the warehouse. We all know now in Amazon warehouses, they are using robotics and a lot of automation techniques to automate the process. That's really needed for us to deal with the COVID situation, because for robotics, you don't have to require a 6 feet separating rule. I also want to mention that Michael Mahevis is working with the medical device makers to allow the hospital staff to remotely monitor and adjust the patient's ventilators. This is not easy to do, but I think he has some good solution. He's working with one of the major medical device makers. Also, Professor Amy Herr is seeking to provide scientific consensus on the face mask sterilization method. Due to time limit, I don't have time to go on and on, but you can go to the College of Engineering website. You can find many other activities and research going on to combat COVID-19. Thank you, Michael.
All right, thanks so much, Max. The next question from the audience is for Henry. Henry, you mentioned the role of data science in elections, and more specifically, what are some best practices for balancing data collection and sharing with regulatory data privacy policies?
I think we're actually going to have to rethink some of the regimes here that we have. We have a whole regime for thinking about how we deal with research, but right now there's a need for speed, for data. Of course, we want to protect privacy, and we're going to have to make sure we do that. But maybe this will rely more upon professional norms that say that you don't disclose that kind of data, because it'll be so important to get at least, for example, often geocoded information, which of course has privacy implications. So I'm hoping that we'll work hard to figure out ways to make data more accessible, more available to researchers, with promises on the part of those researchers that they understand the ethical implications of disclosing those kinds of data, but they need them to actually help solve problems. Then there's the operational side. Given what we've heard already with Michael Eisen, for example, talking about, could it be the case that we could figure out a way to immediately identify people with COVID-19 who get onto a BART train? That data would have to go somewhere, and something would have to happen with that data. And we're going to have to think about how to deal with those problems. You as a public health team know full well that public health agencies have situations where there's mandatory reporting of some kinds of diseases, and there are active efforts to down people's contacts who have those diseases and to then hopefully solve the problem. We're going to have to think about what the regimen looks like for doing that, because that's maybe one route by which we can put the economy back together. We have very good testing, we have very good tracing. Maybe we can tell people it's safe to get together, because we'll make sure that anybody who's a COVID-19 virus carrier is quickly found and asked to quarantine themselves. In fact, probably more than asked.
So Henry, this is a follow-up question for you. Is there an emergent need for these policies to evolve?
Yeah, I think that right now there needs to be a lot of thinking about how to create these new policies in the two areas I've indicated, where I think there will be different kinds of policies. One is more in the traditional public health realm, that's the operational side, but we really need to be thinking about what the new regime might look like in those areas, so that we can put the economy back together, get people working again, but nevertheless keep track of who's got the virus. And then there's the research side, where I think there's luckily a lot of informal norms, and I think the work of IRBs, institutional research boards over the years, has really taught scientists to be very careful about privacy issues. And one hopes that those norms will really be very effective right now, even in situations where people are dealing with rather private and confidential data, but they need it because otherwise you can't do the research.
Okay, thanks, Henry. We've got another question for Kathy. How could research efforts around COVID benefit from better coordination and collaboration among individuals and agencies to eventually form a coherent research agenda? And what's a good course of action to achieve that?
Well, obviously, these kinds of coordinations across federal agencies do take time, and I think people are working quickly at the agency level to try to coordinate it. I would separate the immediate kind of research questions that are coming up in things like supply chain, in epidemiological modeling, and even in coming up in the design of vaccines and scanning through various kinds of compounds and things like that, to some of the longer term research issues that I think will go on for years after this. after this pandemic. So I think that some of that can be done in the fullness of time, but I would say that this general issue of coordination and collaboration among individuals is very personal to me as the Associate Dean for Research in the Division of Computing, Data Science, and Society. I feel like that is my role to try to help people connect across the campus and even connect externally to other projects. I can only say it's been a whirlwind over the last few weeks to try to help people find collaborators. For those of us who've done interdisciplinary science for many years in various scientific disciplines in high performance computing, in which I've worked, I can tell you it's a contact sport. I mean, you have to get deeply involved with people from other disciplines, whether it's mathematics, statistics, computer science, together with biologists and together with epidemiologists and so on, to really understand what the actual problems are that are driving it, and then how to bring your expertise or your tools to bear on those problems. Of course, now it's a virtual contact sport, but nevertheless, it is one that I think we've brought many different groups together across the campus. I feel like my job is partly scientist, partly manager, and partly matchmaker to try to make these things happen. One example I'll give is bringing together researchers that include international researchers, people from industry, people at the lab, at Lawrence Berkeley Lab, and people on campus on epidemiological modeling to try to bring the best possible models to bear and run them on the most powerful supercomputers at the DOE labs, and then to bring together the expertise of the epidemiologists here at the Berkeley campus to really try to understand what we will get out of those kinds of models. So I think that's just the kind of thing that has happened very quickly in just a matter of the last few days, and we will be working, I hope, closely together to try to answer some of these very critical problems.
Let me ask you a follow-up question, Kathy. Why doesn't this kind of transdisciplinary science occur more often, and what's the magic sauce that you see here at Berkeley that makes this type of research collaboration so effective right here at Berkeley?
Well, you know, it is hard. It's very difficult. I often give an example of a meeting I was in many years ago with a computational chemist, I believe, and we talked for about a half an hour. We had a few students and postdocs and other scientists on both sides, and we were talking about the complexity of the systems. And at some point I asked, what do you mean by system? And they said, well, of course, the chemical system is very complex. And of course, one half of the table was talking about the complexity of the computer systems, and the other half was talking about the complexity of the chemistry systems. And we were thought we were talking to each other, but in fact, we're not. And the language it's used across discipline is very hard. How people are acknowledged for their research contributions can be very different across disciplines. So all of those things make interdisciplinary work very hard. I think that right now, people are so motivated and want to try to figure out how they can use their expertise to try to help the problem, that they're less concerned over some of those other kinds of issues, and they're very quickly learning and coming up to speed and figuring out who to collaborate with and how. So I think that's one of the things that makes it hard. And I really do think that the creation of the Division of Computing, Data Science, and Society, I'm hoping that we will be able to help Jennifer and I and the rest of her team to try to bring people together across education and across research and across the campus, and then connecting more broadly throughout the research and education community to make these kinds of things happen.
Well, thank you, Kathy, and thank you, everyone. That's a really helpful Q&A. Now, I want to welcome back Jennifer Chase as we wrap up today.
Hi, can you hear me? Yes?
Yes.
Good. My internet went down in the middle. I'm tethering through a phone. You know, some of the low contact, low bandwidth elements of this high contact sport, as Kathy was talking about it. So I wonder if our two leaders and moderators of this discussion, Saul and Michael, might have some of their perspectives that they have gained being leaders during this crisis, and also some reactions to what we've been hearing. So why don't we start with Saul?
Well, actually, Michael, you go first, because I was going to follow up your thoughts. Yeah.
Sure. Well, first of all, let me just apologize for my internet. I guess it's the whole neighborhood, so I'm having trouble logging back on. But yeah, I just have to say I'm just so truly amazed by how much collaboration across disciplines is going on right now at Berkeley, and not just between public health and data science, but as you just heard, biology and engineering, economics and public policy, and so on. Everyone is really stepping up to the plate, working together to try to solve this crisis. And this kind of transdisciplinary collaboration really cannot be taken for granted. It just doesn't happen everywhere, but it's happening right here at Berkeley, and it's what needs to happen if we're going to find game-changing solutions to this pandemic, or I think any of the other big public health problems that we're going to have to solve as a society, as a world. So I'll just say that I'm truly proud to be here and truly grateful to be working alongside all of you. Saul?
Thank you, Mike. And I was going to just make actually one small point and one big point. The smaller point is just that my impression is that one of the common languages that is really helping bridge the kind of differences of all these different fields that Kathy was talking about is this common language of data science. And the fact that that we're talking today from that point of view is actually partly reflecting the fact that it is now becoming a shared language that people are all using to address these problems together. So I'm optimistic that will help a little bit during this period as people are at least having that in common. But the other bigger thing that I was just noticing as we were pulling together, all these talks and presentations that are both today and the ones that will be coming up. I was just struck by the fact that I think most people are aware that that Berkeley is a leading educational institution, that that we teach very well and we have an important educational role. But I think people sometimes forget that Berkeley as a research institution is an amazing resource, that it's providing essentially one of the leading public think tanks for the state of California and for the world. And that it means that it's possible to respond to these difficult problems, but with a full team of people across all the disciplines who have been developing the long-standing research behind all these questions, that you never can guarantee which one is the one you'll need at any given moment, but you need that depth of a think tank to be able to handle when they show up. And it's just it's wonderful just to watch all of my colleagues coming at this from all these different angles and then integrating together to make this to come up with a response to all this. So I think it's something that we as Californians should feel very proud of, that we have this kind of a research resource to help us.
Okay, well, thank you. I would also like to add that not only are we an educational institution and a research institution, but I feel that we are, part of the local community and part of the state community. And, I really feel that we have a deep public commitment at Berkeley, and this is coming out in all of this research and also in the ways in which we are trying to bring the community together. And I think that this is just the beginning. We are looking at the rapid response, which will go on as the field evolves, and as as COVID-19 pandemic plays out on a short time scale. But there are many parts of the university that will have to step up as we try to unwind this. We have our Graduate School of Education and our School of Social Welfare, which are going to have to be deeply, deeply involved in the long-term consequences of this. We have people in the arts and humanities who are going to help us to understand how we as a society are going to evolve. This is a shock to our society, and we have people throughout this campus who are processing this on different timescales and who really want to connect deeply with the community and with the population of California to help us through this. So I wonder if there is anything else that any of our speakers would like to add to this before we wind down this particular COVID-19 conversation. Anyone?
I would just say, this is Henry Brady, that it's so clear that we're going to have to think through redesigning so much of what we do in this society, and that's an enormous task. And I think Berkeley can be helpful in doing that, given the range of expertise that you've described, Jennifer. And it's really going to be a rethinking project, because lots of things are going to change, certainly in the short run, maybe even in the longer run.
Okay, well, thank you. I think we're very lucky to be members of this university, that we're very lucky to be public servants in the state of California, and that it's our responsibility and our honor to try to help with some of this. So I would just like to thank everyone for this conversation and to let you know that these will be continuing. We have a whole lineup that is being spearheaded by the Berkeley Institute of Data Science, representing the Division of Computing, Data Science, and Society. And we have many, many other parts of campus that will be stepping up and running their own conversations on COVID-19. Thank you so much for joining us.